As physicians, we know that mental health conditions and addressing these conditions is a serious issue in this country. According to the Centers for Disease Control, roughly 25% of adults in the U.S. have some mental health condition or substance use disorder. Treatment varies, of course, by the type of disorder involved, but there's one big obstacle in the fight for better mental health: tobacco, and more specifically, cigarettes. Adults with mental health conditions consume 40% of all cigarettes smoked in the U.S., and that's a problem, a big problem. The most common cause of death among people with mental health conditions are illnesses that can be caused by smoking, like heart disease, cancer, and lung disease. On average, they die 5 years earlier than those without mental health conditions. How did we get here? The smoking gun, or in this case, the smoking butt, is the tobacco industry itself. It has made false claims that smoking cessation is too stressful for people with mental health conditions, and created marketing campaigns specifically targeting people with mental health conditions. But as physicians, we have the power to change the dynamic. Superpowers, actually. Together, we can help and encourage patients with mental health conditions to take that all-important first step to better overall health. So how do we go there? As physicians, we have many tools in our toolbox, or in this case, our medicine bag. But what works best may be different for every patient. So let's consider our approach. Brief interventions. There are many ways to help patients quit smoking, including medication. But one of the most proven and effective approaches is brief intervention. Just a few minutes with patients in your primary care setting can motivate them to understand and change their behaviors. The American Academy of Family Physicians Tobacco Cessation Program is Ask and Act, where you ask every patient about tobacco use and then act on it. We know that advice from a physician can more than double smoking cessation success rates. Patients are more satisfied with their health care if their primary care provider offers smoking cessation interventions, even if they're not yet ready to quit. It won't be easy. There are 5 stages of change for tobacco cessation, beginning with pre-contemplation, where the patient is unwilling to change. That's where you start the conversation. That will be followed by contemplation, where they consider quitting seriously but are still at least 30 days away. The next stage is preparation, where a patient is ready to quit and has set a quit date. In the action phase, they are underway, but may need your assistance to recover from relapses. And finally, maintenance, where they have quit using for at least 6 months and need your continued support. So here's how we get there. The good news is there are many ways to talk to patients about how to quit, but it depends on how motivated they are. For patients who might be on the fence, use the 5 R's approach to increase their motivation to quit tobacco. They are relevance. Find specific reasons why quitting is personally relevant to the patient. Risks. Consider the negative consequences of tobacco use, both acute and long-term. Rewards. Identify benefits of quitting that are specific to that patient. Roadblocks. Think through potential barriers a patient might face and how to overcome them. And finally, repetition. The previous 4 R's should be repeated with every visit, and remind them that most people require several attempts before successfully quitting. You can also help patients develop various coping skills to avoid the triggers that cause relapse. Distractions or substitutions often work. So does making healthy lifestyle and environmental changes, like avoiding other smokers. It's imperative that people with mental health conditions quit using tobacco products to improve both their physical and mental health. Fortunately, there are a variety of resources, medications, and counseling services that can aid them. But their biggest, most beneficial opportunity to take control of their life and quit tobacco use is you, the family physician. So remember, a few minutes with a patient might just motivate them to change their behavior and their life.